Lung cancer is one of the most common and deadliest cancers in the world. It affects millions of people every year, yet many people don't know the warning signs until it's too late. In today's video, we are going to break down everything you need to know about lung cancer. Its causes, types, symptoms, and what you can do to reduce your risk. Lung cancer is the second most common cancer globally, after breast cancer, but it's the leading cause of cancer-related deaths. The numbers are shocking. 2.2 million new cases diagnosed every year. 1.8 million deaths annually. In the US alone, around 130,000 people die from lung cancer every year. Why is lung cancer so deadly? Because it's often diagnosed late when it has already spread. Unlike some cancers, lung cancer doesn't always cause symptoms early on, making early screening crucial. Smoking is the biggest risk factor, responsible for 85% of lung cancer cases. Secondhand smoke. Even non-smokers exposed to smoke are at risk. Long-term exposure to pollutants, especially in cities, increases the risk. Radon gas is a natural radioactive gas found in some homes and workplaces. If a close relative had lung cancer, your risk is higher. Jobs that expose workers to asbestos, arsenic, or diesel exhaust can increase lung cancer risk. Now that we understand the risk factors, let's talk about the two main types of lung cancer and why they matter. The first type is non-small cell lung cancer, which accounts for 85% of all lung cancer cases. This is the most common type of lung cancer and has three main subtypes. Adenocarcinoma is the most common form, making up 40% of lung cancer cases. It starts in the cells that produce mucus and is more common in non-smokers and younger people. It typically grows on the outer parts of the lungs. The next type of non-small cell lung cancer is squamous cell carcinoma. It accounts for 30% of cases and is usually linked to smoking. It starts in the bronchi, which are the central airways, and is often associated with coughing and breathing problems. Next is large cell carcinoma, which is a rarer, more aggressive form that can appear in any part of the lung and grows rapidly. Small cell lung cancer accounts for 50% of the remaining cases. This type is much more aggressive and spreads quickly. It's almost always linked to heavy smoking. It tends to form large tumors in the central parts of the lungs. It also often spreads to the brain, liver, and bones before symptoms appear. Most people with small cell lung cancer are diagnosed at an advanced stage. Because small cell lung cancer spreads quickly, early detection is crucial. But what symptoms should you watch out for? Lung cancer symptoms can be subtle at first, but as the disease progresses, they become more noticeable. Chronic cough that doesn't go away, which lasts for more than 8 weeks. Coughing up blood or rust-colored phlegm. Shortness of breath or wheezing. Unexplained weight loss and loss of appetite. Chest pain that worsens with deep breathing, coughing, or laughing. Hoarseness or voice changes. Frequent lung infections like pneumonia or bronchitis. If you experience any of these symptoms, don't ignore them. The earlier lung cancer is diagnosed, the better chances of successful treatment. So how can you lower your risk? Number 1 is to quit smoking. The best way to prevent lung cancer is to stop smoking. Even if you've smoked for years, cutting now still reduces your risk. Next is avoid secondhand smoke. Stay away from environments where smoking is common. If you live in an area with high radon levels, testing your home can help reduce exposure. Wear protective gear. If you work with hazardous chemicals, use proper protection. Eat a healthy diet. Foods rich in antioxidants like fruits and vegetables may help protect lung cells. High-risk individuals, especially current or former smokers over 50, should get a low-dose CT scan to detect lung cancer early. Lung cancer is a serious disease, but knowledge is power. By understanding the risks, symptoms, and prevention strategies, you can protect yourself and your loved ones. If you found this video helpful, hit that like button, subscribe and turn on notifications for more health-related content. Share this video with someone who might benefit from it. Watch my previous videos to get more information on how cancer affects you and what you can do to prevent it. Stay healthy and I'll see you in the next video.